It's a Tuesday morning. Nothing special about it. You wake up, you make your coffee, maybe you sit in your favorite chair by the window the way you do every single morning, and you notice something. Your left leg feels different, not painful, not numb exactly, just heavy, like it belongs to someone else. You shake it off. Maybe you slept on it wrong. Maybe you need to move around more. You've been sitting a lot lately, so you get up, you walk to the kitchen, you pour your coffee, and you forget about it. That moment, that small, easily dismissed moment, is what this video is about. Because what happened to Margaret, a 67-year-old retired school teacher from Ohio, was exactly that: a heavy leg, a strange tingling she felt for 3 weeks, a sensation she mentioned once to her daughter, who said, "Mom, you probably just need to drink more water." 31 days after Margaret first noticed that feeling in her leg, she had a massive stroke. She survived, but she lost the ability to speak clearly for nearly 8 months. And when her neurologist reviewed her history, he told her daughter something that stopped her cold. He said her body was warning her for almost a month in her legs. Today, we are going to talk about something that most people, most doctors even, don't spend enough time discussing with their patients: the warning signs that appear in your legs before a stroke happens, signs that can show up weeks before a stroke, signs that are routinely dismissed, ignored, or misdiagnosed as something harmless. And if you are over 50, if you have high blood pressure, diabetes, or any history of cardiovascular issues, I need you to watch this entire video, because what you're about to learn could genuinely be the difference between catching something in time and not. Stay with me, because this gets important very quickly. Now, before we go any further, I want to be very clear about something. This video is not designed to frighten you. Fear, on its own, is useless. What we're doing here today is giving you knowledge. And knowledge, the real specific, actionable knowledge, is something that can actually save your life. Stroke is the fifth leading cause of death in the United States. Every year, nearly 800,000 Americans have a stroke. That's one person every 40 seconds. But here's what the statistics don't tell you, what they don't print on the awareness posters, what doesn't make it into the 30-second public health announcements. Most strokes don't happen without warning. Research published in the Lancet Neurology, one of the most respected medical journals in the world, has confirmed that a significant percentage of major strokes are preceded by what doctors call transient warning events: small, subtle signals. Signals that the body sends out, sometimes for days, sometimes for weeks, before a major neurological event occurs. And a growing body of clinical research is showing something that should be taught in every senior wellness class, every cardiac rehabilitation program, every general practitioner's office in this country. The legs often know first. The vascular system, the incredible network of arteries, veins, and capillaries that carries blood throughout your entire body, doesn't operate in isolation. When something begins to go wrong in the blood vessels that supply your brain, it rarely stays quiet in just one place. The disruption travels. It shows up in your circulation. And in many people, particularly people over 60, it shows up most visibly, most consistently in the legs. Now, I know what some of you are thinking. But don't strokes just happen suddenly, out of nowhere? That's what most people believe. That's what Hollywood shows us: the person grabbing their head, collapsing to the floor. And yes, the stroke event itself can be sudden. But what leads to that event? Ooh, that's a different story entirely. And that's the story we're telling today. Now let's start at the beginning. Because to understand why your legs carry these warnings, you have to understand what's actually happening inside the body in the weeks before a stroke. Most strokes, roughly 87% of all strokes, are ischemic strokes. That means they happen when blood flow to part of the brain is blocked, usually by a clot, or by a narrowing of the arteries that has been building silently, invisibly, for months or even years. Now, here's what's critical to understand. The process that causes a stroke, the buildup of arterial plaque, the formation of clots, the narrowing of blood vessels, is not a brain-only problem. It is a systemic problem. It happens throughout the body's entire vascular network. Think of your circulatory system like a network of pipes throughout a very large building. If the water pressure is too high and the pipes start corroding and debris starts building up inside them, that doesn't happen in just one pipe. It happens throughout the system, and the pipes that run the longest distance, the ones working hardest against gravity, the ones furthest from the central pump, those are usually the first to show signs of trouble. In your body, those pipes are the vessels in your legs, the femoral artery, the popliteal artery, the smaller peripheral vessels that branch down through your calves and feet. These vessels are the longest in your body. They work against gravity every single day. And when systemic vascular disease, the same disease that leads to stroke, begins to develop, the legs are often the first to feel it. This is not theoretical. This is documented in peer-reviewed research. A landmark study published in the Journal of the American Heart Association followed thousands of adults over 55 for nearly a decade. And what they found was striking. People who had signs of peripheral arterial disease, reduced circulation in the legs, had a significantly elevated risk of stroke and major cardiovascular events within the following years. The legs and the brain share the same vascular story. When one is struggling, the other is often already at risk. Now, let's talk about what that actually looks like. What does your body show you? What does it feel like? Because this is where most people make the mistake that Margaret made. They feel something, and they explain it away. We're going to go through 7 specific warning signs that can appear in your legs before a stroke occurs. And for each one, I'm going to tell you a real story. Because this is not about abstract medicine. This is about real people, real moments, real decisions that changed everything. Number 7 is something almost everyone over 60 has experienced and never connected to stroke risk. And number three is the one that medical professionals say is the most consistently ignored warning sign of all. Stay with me. The first warning sign is unexplained heaviness or unusual fatigue in one or both legs. Now, I want to be careful here because leg fatigue is common. We all get tired legs. If you've been on your feet all day, if you've been gardening, if you walked more than usual, that's normal. What we're talking about is different. What we're talking about is a heaviness that has no clear explanation, a tiredness in the legs that arrives without effort. That's there when you wake up in the morning, before you've done anything at all, or a fatigue that comes on unusually quickly, walking a distance you normally handle easily, and finding that your legs feel like lead halfway through. Robert was 71 years old. He had been managing high blood pressure for about 6 years. His doctor had him on medication. His numbers were mostly controlled. He exercised, nothing intense, but he walked his neighborhood every morning, about a mile. Same route every day for years. About 5 weeks before his stroke, Robert noticed something on his morning walk. Halfway through, maybe half a mile in, his legs felt wrong. Not painful, not cramping, just extraordinarily heavy, like he was walking through wet concrete. He started cutting his walk short, going half the distance. He mentioned it to his wife, who suggested he was probably just getting older. He told himself the same thing. What Robert didn't know, what nobody told him, was that this sudden, unexplained reduction in his leg endurance was almost certainly a sign that blood flow through his peripheral vessels had significantly decreased. His body was already rationing circulation. The same vascular restriction that was tiring his legs was quietly building pressure in the vessels that fed his brain. Now, here's what research tells us about this specific symptom. Peripheral artery disease, PAD, affects an estimated 8 to 12 million Americans. And one of its earliest, most consistent symptoms is exactly what Robert experienced: claudication, a cramping, fatigue, or heaviness in the legs during activity that improves with rest. But here's the critical connection that most people, including many primary care physicians, don't make often enough. PAD and stroke share almost identical risk factors and underlying causes. Atherosclerosis, the buildup of plaque in the arteries, doesn't choose. It affects the arteries in your legs and the arteries feeding your brain. A person with PAD has a risk of heart attack and stroke that is comparable to someone who has already had a heart attack. That statistic bears repeating. If you have peripheral artery disease, if you have reduced blood flow in your legs, your stroke risk is as high as someone who has already survived a cardiac event. And yet, most people who feel that unusual leg heaviness never connect it to their brain. They think tired legs. They don't think vascular warning. That is the gap this video is trying to close. The second warning sign is sudden, unexplained swelling in one leg, particularly below the knee. Now, swollen legs are extremely common in older adults. We know this. Standing too long, sitting too long, hot weather, salt, certain blood pressure medications can cause fluid retention. All of this is true. But there is a very specific type of leg swelling that is not about fluid retention, and it can be life threatening if missed. It's called deep vein thrombosis, DVT, a clot that forms deep inside the veins of the leg. And here is why this matters so profoundly in the context of stroke. If a DVT clot breaks loose, if a piece of it detaches and travels through the bloodstream, it can travel to the lungs, causing a pulmonary embolism. Or in people with a common heart condition called patent foramen ovale, a small hole in the heart that an estimated 25 to 30% of adults have without knowing it, that clot can cross into the arterial system and travel to the brain. This type of stroke, called a paradoxical embolism, is more common than most people realize. And its first visible warning? Swelling in one leg, often accompanied by warmth. Sometimes a dull, aching pain that people mistake for a muscle strain. Eleanor was 64. She'd been on a long flight, visiting her grandchildren across the country. 11 hours of travel, including layovers. When she got home, her right calf was visibly larger than her left. Puffy. A little warm to the touch. She assumed it was the flight. Everyone gets swollen legs on planes. Her husband suggested she elevate it and drink more water. 17 days later, Eleanor had a stroke. She was in the shower when it happened. Her husband found her sitting on the floor of the tub, confused, unable to lift her right arm. She spent 6 weeks in rehabilitation. The DVT in her leg had been there. The warning had been visible. But nobody, not Eleanor, not her husband, not the neighbor she'd casually mentioned it to, recognized what it meant. The signs of DVT that you should never ignore. One leg noticeably larger than the other, particularly the calf. Skin that feels warm or looks reddish in one specific area of the leg. A persistent dull ache that doesn't go away the way a muscle strain would. Pain that gets worse when you flex your foot upward. Any one of these, persisting for more than 24 to 48 hours, warrants a call to your doctor. Not a wait and see. A call. Because a DVT that is caught and treated is manageable. A DVT that travels to the brain is a stroke. Now we come to the third warning sign. And I told you earlier that this one is the most consistently ignored. The one that medical professionals in clinical reviews of pre-stroke patient histories see again and again. A sudden change in skin color or temperature in one foot or lower leg. Specifically, one foot or lower leg that becomes noticeably paler, more bluish, or significantly cooler than the other. This is called acute limb ischemia in its severe form. But in its early, subtle form, the form that shows up weeks before a major event, it can look like nothing more than one foot being slightly cooler than the other. One ankle that looks a little pale. One area of the lower leg where the skin has a slightly different color or texture than before. People don't call their doctor about a cool foot. People don't rush to the ER because one leg looks a little pale. And that is precisely why this warning is missed. What's actually happening, in clinical terms, is this. When arterial blood flow to the lower extremities becomes significantly reduced, either from a clot, from severe arterial narrowing, or from vasospasm, the tissues downstream receive less oxygen, less blood, less warmth, less color. And the same arterial disease causing that reduction in your leg is present in the arteries feeding your brain. James was 69 years old, a former postal worker who spent decades on his feet. He'd had diabetes for about 12 years, managed it reasonably well, a 1C in acceptable range most of the time. One morning, about 3 weeks before his stroke, his wife noticed something while they were sitting watching television. She looked down at his feet. "James," she said, "why is your left foot white?" He looked down. His left foot, from the ankle down, was noticeably paler than his right. Not dramatically, not frighteningly, just different. He wiggled his toes. They moved fine. He touched the foot. A little cool, he thought. A little. He mentioned it to his wife. They both agreed it was probably his circulation. You know how diabetics get. James had a stroke 22 days later. When his vascular surgeon reviewed his imaging after recovery, he found severe bilateral arterial narrowing in his legs and in the carotid arteries feeding his brain. The pale foot had been a window into what was happening everywhere. The critical message here, and I want you to hear this clearly, people with diabetes are at particular risk because diabetic neuropathy, the nerve damage that diabetes causes over time, can actually reduce your ability to feel the pain and discomfort that would otherwise alert you to vascular problems in your legs. You may have significant arterial disease in your lower limbs and feel nothing, which is why the visual signs, changes in skin color, changes in temperature that a hand can detect even when nerves can't, become even more important. Check your feet, both feet, look at them. Compare them every single day. It takes 30 seconds, and it might be 30 seconds that changes everything. The fourth warning sign is tingling, numbness, or a pins and needles sensation in one leg or foot that comes and goes. Now, and this is important, occasional tingling from sitting cross legged or from a pinched nerve is normal. What we're describing is different. Tingling or numbness that has no obvious postural cause, that appears in one leg and not the other consistently. That seems to come and go over days or weeks. That is accompanied by any weakness in the leg. This type of intermittent neurological symptom in the legs can indicate what doctors call a transient ischemic attack, a TIA, often called a mini stroke. TIAs are medical emergencies. Even though symptoms often resolve on their own, even though they can last only minutes, research from the New England Journal of Medicine shows that roughly 10 to 15% of people who have a TIA will have a major stroke within 3 months, and nearly half of those major strokes happen within the first 48 hours. A TIA that affects the motor or sensory pathways controlling the legs can produce exactly this kind of brief, intermittent tingling or weakness. It's not just pins and needles. It's your brain telling you it just had a close call. The fifth warning sign is cramping in the calf, thigh, or buttock during physical activity that reliably stops when you rest. This is textbook intermittent claudication, the hallmark symptom of peripheral artery disease. And I cannot stress this enough. Claudication is not a leg problem, it's a vascular problem. The cramping you feel when you walk to the mailbox and back, the tightness in your calf that makes you stop and lean against the wall, that's not your leg muscle failing. That's your leg muscle screaming for blood it isn't getting. Because the artery delivering that blood is narrowed. And that same narrowing process is almost certainly present in other arteries throughout your body, including, and this is the point, the arteries that supply your brain. A study in Circulation, the flagship journal of the American Heart Association, found that people with symptomatic PAD, including claudication, had a 2 to 4 times higher risk of stroke compared to people without PAD. 2 to 4 times. If you have cramping in your legs during activity that reliably resolves with rest, now tell your doctor. Not as an aside at the end of the appointment. Make it the primary reason you call. The sixth warning sign is slow healing sores or wounds on the feet or lower legs. This one particularly affects those with diabetes, but it applies broadly to anyone with compromised circulation. When blood flow to the lower extremities is reduced, the body's ability to heal minor cuts, blisters, or abrasions is dramatically impaired. A small cut that should resolve in a few days lingers for weeks. A blister that seems minor develops into a sore. These slow healing wounds are a visible physical manifestation of compromised vascular health. They are the skin's way of showing you that circulation is failing. And failing circulation in the legs, as we've now established repeatedly, is inseparable from the vascular story happening throughout your body, including in the vessels feeding your brain. And now we come to the seventh warning sign, the one I promised you at the beginning, the one that almost everyone over 60 has experienced and never once connected to stroke risk. Restless leg syndrome, or unusual nighttime leg discomfort that suddenly worsens or changes in character. Now, restless leg syndrome is extremely common. Many of you watching may have been living with some form of it for years. And in most cases, it is a manageable nuisance, not a medical emergency. But here's what research is beginning to reveal. A study published in Neurology, one of the most prestigious journals in the field, found that people with restless leg syndrome had a significantly elevated risk of cardiovascular events, including stroke, particularly when the RLS was severe, recently worsened, or accompanied by periodic limb movements during sleep. The proposed mechanism involves something deeply important. Restless leg syndrome, at the vascular level, may be connected to endothelial dysfunction, impaired function of the cells that line our blood vessels. The same endothelial dysfunction that contributes to arterial stiffness, the same arterial stiffness that contributes to stroke. Again, not independent problems. The same systemic story. What should concern you specifically is this. If you have had restless legs for years and suddenly, in the past few weeks, the symptoms have significantly worsened. If the discomfort is now keeping you awake when it didn't used to. If you're noticing it during the day now, not just at night, these changes in pattern are worth discussing with your doctor in the context of cardiovascular risk, not dismissing as aging, not normalizing. Let's take a step back now, because I want to make sure that everything we've covered today lands in the right way. We've talked about 7 warning signs: unexplained leg heaviness or fatigue, sudden swelling in one leg, changes in skin color or temperature in one foot, intermittent tingling or numbness in one leg, cramping during activity that resolves with rest, slow healing wounds on the lower legs or feet, and worsening restless leg symptoms. Now, none of these signs on their own proves you are about to have a stroke. I want to be very clear about that. Many of these symptoms have multiple causes, most of them far less serious than stroke. But here's the truth that this video has been building toward. These signs matter. They deserve attention. They deserve a conversation with your doctor. Not because any one of them is a definite alarm bell, but because the pattern, the combination, the context of who you are, how old you are, what your blood pressure is, what your blood sugar does, whether you smoke, how you sleep, what your family history looks like. That context is what makes these signs meaningful. What we often see in clinical medicine is this. Patients come in after a stroke, and when we sit with them or with their families, and we take a careful history of the weeks before, the signs were almost always there. Not screaming, not dramatic, but there. A leg that felt heavy, a foot that looked pale one morning, a cramp that came and went. The body was speaking. No one knew how to listen. Today, you know how to listen. So what do you actually do with this information? Let me give you something concrete, something you can start today. The first step is what I call the daily 60-second leg check. Every morning, before you get out of bed or right when you sit up, spend 60 seconds doing this. Look at both feet side by side. Are they the same color? The same temperature roughly? Do both legs feel similarly awake and ready to move? This takes 1 minute, and it could be the most important minute of your day. The second step is to know your walking baseline. Pay attention to how far you can comfortably walk before your legs feel tired or uncomfortable. If that distance suddenly decreases, if you're stopping sooner, feeling leg fatigue earlier than usual, write it down. Note the date, note what you noticed, and bring that note to your next doctor's appointment. The third step is to have the ABI conversation. There is a simple, painless, non-invasive test called the Ankle Brachial Index, the ABI. It measures blood pressure in your ankles compared to your arms, and it's one of the most reliable ways to screen for peripheral artery disease. If you are over 60 or over 50 with diabetes, high blood pressure, or a history of smoking, ask your doctor specifically, should I be screened for peripheral artery disease? Can we check my ABI? Most primary care physicians can do this in their office. It takes minutes, and it can reveal vascular disease years before a stroke or heart attack occurs. The fourth step, and perhaps the most important, is this. Don't explain away new symptoms. When something new happens in your legs, something that wasn't there last month, resist the automatic impulse to normalize it. Resist, I'm just getting older. Resist, it's probably nothing. Resist, I'll see how it is next week. Instead ask, is this new? Is this different? Does this fit any pattern I should mention to someone? Your instincts are valid. Your symptoms deserve to be heard. I want to close today with something that I think about often. Margaret, the retired school teacher I told you about at the beginning. The woman who had the heavy leg for 3 weeks before her stroke. After 8 months of speech therapy, she recovered most of her language. She goes to a stroke survivor group now, every Tuesday morning. And she told me something that I've never forgotten. She said, "The hardest part isn't the stroke itself. The hardest part is knowing that my body tried to tell me, and I didn't know how to hear it. That's why this matters. Not to frighten you, not to make you anxious every time your leg falls asleep, but to give you the language to hear what your body is saying. You have been given today information that most people do not have, information that takes most people a diagnosis or crisis to finally receive. Use it. Check your legs, know your baselines, talk to your doctor, and please share this video with someone you love who is over 60, because the 30 seconds it takes to send this video could be the 30 seconds that changes their life. I'll see you in the next one. Before you go, I have a quick request. If something in this video made you think of someone, a parent, a spouse, a friend, a neighbor, please share it with them. You don't have to say anything dramatic. Just send them the link, text it, email it. Let the video do the work. And if this video helped you, if you learned something today that you didn't know before, hit the like button. It genuinely helps more people find this content. More people who might need it. We've got more videos coming on vascular health, stroke prevention, blood pressure, diabetes, and everything in between that affects those of us in the second half of life. Subscribe and turn on notifications so you don't miss them. Take care of yourself, take care of the people around you, and I'll see you in the next video.